Coming up, we'll be on location at the Maryland Center of Aesthetic Dentistry in Baltimore, Maryland, discussing the benefits of dentistry and how they can help improve your dental health and give you the beautiful smile you've always desired with one of this region's top dentists, Dr. Daquant Hornbeak. Dr. Hornbeak received his DDS degree from Howard University Dental School. He is a member of the American Dental Association, among other organizations, and is widely recognized as one of this area's leading dentists. Welcome, Dr. Hornbeak. It's a pleasure having you on our program.
Oh, thank you for having me on the program.
It's your first time, in fact, on the Top Doctors Medical Interviews.
Yes.
We have a lot to talk about. We have some topics that I definitely feel that all of us, the public, really needs to be made aware of as far as benefits of dentistry. There's some advances that have taken place due to technology, which is benefiting so many. So I wanted to begin, if I may, by asking you, Doctor, if you can please tell us what are some of the benefits of dentistry.
Okay, there's three main benefits of dentistry. Two of them are technological advances that have happened. One is called Identify, and it's an oral cancer screening device. The second main advancement is the digital x-rays. Back in the day, the x-rays were not digital, and there was a lot of radiation with them. And now the x-rays that we use are digital, and you get more radiation from flying on a plane from California to New York than you do from coming into the dental office. So that's the two technological advancements in dentistry. The third one is just when patients come in, we can catch things while they're small so they don't get bigger. Because if it gets bigger, it's going to get more expensive and it's going to cost them more, and then, it'll be better for them to come in, earlier.
Yes, indeed. Being proactive instead of reactive later.
Oh, yes. Oh, yes.
Right?
Yes.
I wanted to ask you, Doctor, what effect does dental health have on our overall health? Because a lot of folks aren't aware that one does affect the other.
Oh, yes. Well, the oral cavity, or the mouth, is the gateway to the other parts of the body. We chew our food there. We break down our food there. If it's also linked to other diseases. If we have periodontal disease, which is disease of the gums and the bone, then it can make other conditions worse. Some of those conditions are diabetes. Some of them are even heart issues. So it makes those issues even worse. And right now, there's a statistic that 91% of patients that have heart disease also have periodontal disease too. So it's just a matter of time before the science comes together where both of our fields can work together, the medical and the dental field, to where we can start to treat patients as a whole together. But we're the first line, with that disease. Yeah.
Very interesting. I would not think that the number would be that high.
Oh, yes.
That is significant.
Oh, yes.
And what are some of the most common dental problems that you see in your patients, Doctor?
The most common dental problems are actually cavities and periodontal disease. Those are the two most common, issues that we run across.
And what are some of the treatment options that you have at your disposal to help your patients with those problems?
We have fillings. We have something called inlays, crowns. We do root canals and other things. So whatever the condition of the tooth is, that's how we will treat it, depending on how severe the problem is. We have something called Atrodox, which for patients that have periodontal disease, Atrodox is an antibiotic that we can place in the gums where it stays there for 21 days. Because what we're fighting bacteria, which is something that I can't see or the patients can't see, but underneath the gums with the Atrodox, it stays there for up to 21 days.
Very interesting. And I also understand you have a big focus on cosmetic aesthetic dentistry as well.
Oh, yes.
And you offer a number of treatments. Can you please tell us about some of those for the folks that want that new smile?
Oh, yes, the Hollywood type smile. We do supply that as well, where the veneers from the smile line, which is from premolar to premolar, or all the teeth that you see when you smile. We do provide the veneers or crowns if needed, depending. We try to be as conservative as possible. We don't like to take off too much tooth structure if not needed. There's also ways to where we can do veneers for patients and not even have to touch the teeth. That's where the technology is advanced to that point.
My goodness, how things have changed all to our benefit, right?
Oh, yes.
And what I find most impressive with your work having looked at some before and after pictures of some of your patients, is that when people do have a cosmetic procedure through you, doctor, that it looks very natural. It doesn't look like we had something done.
Oh, yes.
And I think that's what we all strive for as patients.
Oh, yes. Us in the dental field, we work in millimeters, so everything is real small for us. So everything sticks out for us. But we try our best to make it to where other people won't notice it. And a lot of times when I do a big case for patients and they go out into the field and they ask other people, do you notice a difference? And people don't. And because if you can do a very good case, other people will not notice. They will notice, but other people will not notice.
Yes. And I also understand that you have dentures that you offer for
patients
who can benefit from that?
Yes. We have multiple dentures that we offer. There's flexible type dentures, there's metal-based dentures, and there's also implant retained dentures where you can get implants and have a denture on top of that. They're not like the mom and pops dentures of the old. Like we said, we have flexible ones and we have ones that are, to where people won't really notice unless you're doing an examination. But a lot of dentists or even people that you run into contact with will not notice. You can eat, drink, and function with the dentures in the mouth as if you had regular teeth.
And what kind of results can we expect from these treatments that you told us about, doctor?
The best results. We use one of the top labs, and we work in conjunction with the lab if you're going to need a case that we have to send outside. So with the lab and with our technology in our office, then it's very good results.
So you basically, obviously based on each particular patient,
yes,
customize a solution based on his or her needs, whether it's general dentistry, cosmetic dentistry, whatever their problem or problems are, and you work with each patient individually and give them that personal attention to make sure that they're very satisfied with the work.
Oh, yes, totally. They're individual custom treatment plans for the patient. We work within their budget, also within their plans, their long-term plans for their treatment. And that's how we do. We put everything into conjunction to where we have the treatment plans that are specifically designed for you.
And do you also have a preference as far as how often you recommend that a patient come back and get checked out? Is it every 6 months? Is it once a year? I know, again, it depends on each patient, but in general, how often should a patient visit their dentist?
That is a very good question. A lot of patients don't really understand this. If you have very good oral hygiene, then it's twice a year. But I would say about 60 to 70% of patients out there do not have that hygiene. So really they need to come back every 3 months for basic cleanings, and because it takes that long for the calculus to really build back up. So within 3 months we want to see our patients. I would say most patients are every 3 months, but if you can come in 2 months, that's good. But for you to come in once a year, that's not a good thing.
We're now going to meet a couple of patients of Dr. Hornbeak. Welcome, Kelly. It's a pleasure having you on our program.
Hi, thank you for having me. It's really nice to be here too.
Well, we always appreciate it when patients take time in their busy lives to come down and share some of their experiences with us. I just wanted to begin, if I may, Kelly, by asking you if you can please tell us what brought you to Dr. Hornbeak.
Well, I came in to have a few fillings done and a cleaning, and it was wonderful.
Oh, okay. And you've been a patient of his for some time?
Yes, for a year.
Oh, and what would you tell the folks out there that are watching as far as how your experience has been with the whole process here, including the staff?
Oh, it's wonderful. The staff is so friendly and welcoming. Dr. Hornbeak is so gentle. He explains everything. You hardly even know he's working in your mouth, and I can't wait to come back.
That says a lot.
Right.
Because a lot of folks, they don't look forward to going to the dentist, and your experience has been such wonderful, relaxing atmosphere that
very relaxing,
that you actually like coming back.
Yes, and I love the way he explains everything like so thoroughly and makes me feel at home. I feel like I'm at a spa.
Well, on that note, we'd like to thank you, Kelly, for joining us, sharing some of your experiences, and being
You're
a guest
welcome.
on our program. Welcome, Antonio. Thanks for joining us.
Well, thank you.
Now, I wanted to ask you what I just asked Kelly a few moments ago, and that is, what brought you to Dr. Hornbeak, Antonio?
I'm ex-military, and during my military career, I had some fillings done, and I pride myself in making sure my brushing, flossing, and everything like this there. And when I came in, I had to have 2 crowns done. And lo and behold, to me, I was very upset. You know, I've heard bad things about crowns and, you know, they don't fit or marginal leakage and everything like this here. But after he explained to me what they were and he showed me the video and everything, he broke it down. And now that they don't use PFM crowns anymore, they use all porcelain, or I think he said zirconium crowns. Yeah. It literally made the decision more easier, where they, I know it's going to last. And he was saying that the material displaced with, you know, it's fluoride, so that I can keep my teeth.
Yeah, so you said,
pretty
okay,
much.
then I'm going to have that done. Once
Yeah.
you found out they're safe and they don't have the problems that crowns years ago used to
Yeah,
have.
and they showed me a videos, like I think they said they called the hammer test. One was a PFM, they took with a hammer and it shattered, and then there was another one that just went into the wood because it was the strongest, you know, your natural tooth structure. So I was like, okay.
So then what was the process like for you having that done here? Was it painless, or was it comforting? Can you tell us?
I mean, Dr. Hornbeak did a wonderful job. He explained everything to me as far as from start to finish. Even like I said, the treatment was fine. Explained everything. And as far as the working was very, you know, it's like he made sure that if I felt anything, he stopped right away. You know, gave me a break, or even also, you know, if I needed more anesthesia. Dr. Hornbeak really catered to the need of me, and I was very pleased with the results that I received here at Maryland Center of Aesthetic Dentistry.
Wonderful. And before we let you go, what would you tell the folks about your experience with the staff here as well?
Oh, friendly and very courteous and educated. It's like from the front staff, you know, explained to me what was going to go on, and then as far as the assistant, they explained to me as well what was going on as far as, you know, what to expect, what not to expect. If they had any problems, they gave me a lot of post-op. And then, matter of fact, they even called me the next day, you know, just to check on me. So I was very pleased with that.
Well, on that note, we'd like to thank you, Antonio, for joining us and being a guest on our program.
I thank you. Okay.
Our pleasure.
All right.
We're now back with Dr. Hornbeak. Now, we're literally out of time, Dr. Hornbeak, but I wanted to ask you before I let you go, you and your practice, the Maryland Center for Aesthetic Dentistry,
Yes.
You actually have 2 locations.
Yes, we do.
Not just here in Baltimore, Maryland, but you also have another practice, another office in the Bowie-Mitchellville region.
Yes.
To make it really convenient for the patient.
Oh, yes, yes.
To come to you by offering the 2 locations.
Uh-huh.
But you have really established a reputation for not only excellence in dentistry, but also patient care. And I
Yes.
just wanted to ask you if you can please tell us what helps you separate your practice from many of the others.
Well, we have an outstanding staff here with multiple years of experience, over 20 years collectively. And the second thing is our objective is patients first. So everything we do is to cater to the patients to make sure that they're served and that they get the best treatment possible. So with those 2 combinations, us having the technical skills to do the work, and also with the patients coming first, that's what separates us from.
And I heard you
our-
really also follow through with the patients after
Yes.
they leave here
Yes.
from different treatments to make sure things are coming along just fine. And
Yes.
if there's any questions or concerns they may have, I mean, you really take patient satisfaction to the next level.
Oh, yes, yes, we do. We call after each patient the next day to follow up. And if there's still some kind of discomfort or something that they're uneasy with, then we'll continue to follow up until it is taken care of and their questions have been answered.
Well, on that note, I'd like to thank you, Dr. Hornbeak, for joining us, educating us
Yes.
on benefits of dentistry, some advancements that have taken place that obviously help us a lot. And on that note, we'd again like to thank you, and we'd love to have you back on in the future sometime.
Okay, thank you. Appreciate it.
Thank
and
you.
we'll be back.